on 3 topics in sleep medicine related to pulmonary. And our first speaker, Dr. Tashman, is in the sleep clinic. That's where her appointment is. She's also boarded in neurology and sleep, both, right? Yeah. So please help me welcome her for her presentation on how we sleep through the years, which in my case is not very good.
Thank you so much. I have no disclosures to make. I'd first like to start by this case. This 19-year-old woman comes in reporting difficulty falling asleep. It takes her about 4 hours to fall asleep, and she states she's excessively sleepy with an Epworth sleepiness score of 19/24. She states that her sleepiness started when she was in high school, and the way that she would combat it was she'd listen to very, very loud, heavy metal music and also drink unlimited amounts of coffee in order to stay awake. She denies cataplexy, hypnopompic hallucinations, or sleep paralysis. Now, when she came into the clinic, we went over her sleep schedule. If you look here, we separate it based on weekdays and weekends. During the weekdays, she'd go to bed at 10, she'd fall asleep at 2 a.m., and then she'd wake up at 6:30 a.m. So notice that it's taking her about 4 hours to fall asleep, and once she does fall asleep, she's sleeping for 4.5 hours. But then on the weekends and on vacations, she would go to bed at 2 a.m. and wake up at 11 a.m., and during that time, she was getting 9 hours of sleep. So she has a condition with what's called delayed sleep phase disorder, and this is a circadian rhythm disorder. And so her desired sleep time is to go to bed at 10 p.m. and wake up at 6:30 a.m., but there is a major delay in her sleep period where she goes to bed at 2 a.m. and wakes up at 11 a.m. And so on the weekdays, this is producing an inability for her to fall asleep and wake up at her desired time. But on the weekends, her sleep quality and duration are normal. This condition is most common in adolescents and young adults. The prevalence is approximately 7 to 16%. So if we look here at the brain, there's a region right here. It's in red, and that's a part of the brain that determines the internal pacemaker. It's called the suprachiasmatic nucleus, and it's based on an internal clock that's 24.2 hours long. But as you know, the Earth rotates on a 24-hour